To this meeting, as I earlier said, is Professor Gordon Awandari, our Pro-Vice Chancellor for Academic and Student Affairs. On my right side, we have Professor Rosina Martin, who is the Dean of Student Affairs. And then on my far right, we have Dr. Mark Frimpong, who is the Director of University Health Services Directorate. Next, towards the end of the row, is Dr. Efua Amwabin, who is the head of the Public Health Unit of University Health Services Directorate. And next to her, we have Mr. Mausi Gloza, an administrator in the Pro-Vice Chancellor's office. The hospital administrator is around. I can't, okay, she's there. Mrs. Annie Ayesu. You've been dealing with her. My name is Dr. Niziami Abonya, Director of Public Affairs. You are most welcome. At this point, I'll turn to Dr. Esiedu Bekwen, Director of Health Services Directorate, to kindly introduce the team from the Ghana Health.
Thank you very much, Honorable Minister, BC. I want to introduce our team from Ministry of Health. So I'll start with our boss. He's the Honorable Minister of Health, and also an MP for Tamboso. He's the president of Honorable Obran Akano. Next to him is our chief director, newly appointed chief director. The person of the Desmond Asad. Desmond Boating. Forgive me. So I'm Dr. Franklin and Sheila Payne. I'm the director of public health. Next to me is Dr. Oliver Komi. He's a public health specialist and also the director in charge of the Ghana Institutional Disease Center. Then we have Dr. Robert and Sarah. He is the regional director for Greater Accra. The next to him is the director of procurement. He's the person of yes, Mr. Bright Ijekum. Dr. Bright Ijekum. And then next to also the last one is Mr. Jacob Ando. He's the PR for Ghana Health Service. And then so basically I think that introduce the key person from the Ministry of Health. Thank you very much.
Thank you very much, Dr. Esiedu Bekwen. I'll now turn to our host, the Pro-Vice Chancellor, to kindly call the meeting to order. Thank you.
All right, thank you very much. Honorable Minister, good morning. Good morning to all our colleagues from the Ministry and the Ghana Health Service. Good morning to management of the University of Ghana Hospital, Dean of Students, everybody. Good morning and thanks for coming. So this morning we are indeed honored that the Minister himself has taken time to pay us a visit and to learn more about our current COVID outbreak. Honorable Minister, a few weeks ago we had reports from our hospital that the positivity rates in samples that they sent for testing had spiked. We are very mindful that COVID has never completely gone. So occasionally having COVID cases is not necessarily a cause for alarm. But what caught our attention was that the percentage of positive cases was quite high and more than usual. So we put a few measures in place. As a university, we did not want to close down the university because that would be an overreaction. But at least what we could do was to sensitize the community about the ongoing outbreak and to advise everybody to take the necessary precautions. In addition, with the Dean of Students, we decided to suspend large social gatherings. So basically, gatherings that were non-essential for academic work, we suspended those for the time being. And students are not happy with us, but as management, we need to do what we need to do. They had all weeks and artist nights and all that planned, but we couldn't allow that to continue. In fact, the background of this particular outbreak seems to be one of those artist nights where we think there was some super spreading that took place, and afterwards, that's when we started to see the spike in cases. So obviously, we had to learn from that and to stop such programs from continuing until we brought this under control. Thankfully, I think with the steps that we've taken and with the support of the Ghana Health Service, the data that we've seen shows that it seems that the outbreak is slowing down. The rate of positivity is reducing, and we think that we are moving in the right direction. If we sustain the steps that we put in place over the next week or two, I think we should be back to pretty manageable levels, and we can get on with full academic work. So, Honorable Minister, that's where we are. We are grateful for the support of the Ghana Health Service and your ministry. Obviously, we have many needs that if we get the opportunity, we'll let you know how you can continue to support us, as you know. But I just want to assure you that as an institution, we work with evidence. We don't take decisions based on rumors or hearsay. And you are aware that we have high quality laboratories on campus, high quality public health scientists here. So I can assure you that all decisions are taken with all the necessary scientific information, and we'll continue to follow the necessary evidence as we ride out this storm. Thank you.
Good. Let me use the opportunity to thank you very much, the university management, for how swiftly you've contributed in containing the spike. We picked the signal somewhere last 2 weeks when we were far away in Brussels, and I was constantly in touch with the Ghana Health Service. The Director General was with me there, so on an hourly basis we're reviewing the cases. And so since the cases were reported, we have been having a lot of engagement and deploying one after the other. And so we are grateful for how far you have cooperated. But I thought it was very important for me to come and see, to have first-hand information, especially so today I'm going to have the opportunity to brief the whole country through Parliament on the situation. And I will be very brief here because we'll have the opportunity to give details briefing on the situation, among other things, about mpox, cholera, and the flu as well. And so it's a very short mission, just to come and have first-hand information of whatever is happening. It's good to hear that the spike has been well contained, and just like you have also mentioned, we all have to bear in mind that COVID is still with us. It's not gone completely. And I can also assure you that neither is our resolve to tackle the COVID is also gone. And so we'll do as much as possible. Anytime you think that you need our assistance, we are just a phone call away. Let's cut the bureaucracies and then go straight to the point to tackle the issues before it gets out of hand. So what I will want to plead with you is probably to improve upon the collaboration, the relationship, so that sometimes we must all be part of how we communicate some of these issues, because you are all aware how the public has developed interest in this matter. So sometimes the communication also helps. How we communicate is also very important. You don't create vacuum. If you create a vacuum, people will fill the vacuum with speculation. And so going forward, let's build on the collaboration, the relationship. Anytime you detect anything, let's know and see how we can come in to manage the situation and how we can also contribute to the communication. So I think I don't have much to say than to go to the field and see whatever is happening here myself. And just as you indicated, if you have some requests, you can let it come, and then we'll see how we can manage it quickly. Okay. Because the spike must not go beyond the boundary. Yeah. So we all should come in to contribute. So if there's anything beyond you, please quickly let us know. We are willing and ready to support you. Yes.
Thank you, sir.
Thank you very much, Honorable Minister and Vice Chancellor.
forget your social distancing.
Can you wear your mask?
So the media, we cannot go in there. We can film from afar.
Can you make one come and take it, come out and we have another. No, not all.
He says I should enter, please.
So there's somebody behind you.
Sweetheart, so let me enter so that the person can enter, please.
Resulting in its inflammation as the immune system with even confusion. Or worse, it might lead to severe complications like oxygen supply through ventilators. But these symptoms will depend on a lot of factors such as age, the condition of your immune system, and your current health status. But here is good news, my friends. After intense study and research, scientists around the world have managed to develop a vaccine to fight this virus. Yes, the vaccine contains a part or dead version of the virus, which is injected into the person's body. This is done to expose your body to a weaker version of the virus
Because there's so much high public interest in it. So everybody wants to know what's really happening. So it's in our own interest to let the public know. Else people will feel in speculation. So what we do is that out of the things you mentioned, we have the hand sanitizers, we have the nose mask. What we don't have at the moment is the pens you mentioned, but I will activate the process and to get you about 1 or 2 pens immediately, because let us all contribute in containing it here. That's what is important. So whatever you need, whatever it takes for us to contain it here, let's do. So with immediate effect, I'll tell the procurement people to get you the pens. Yes, we'll do that. Okay, man. So make sure within my close of data, let's get it through separate. Okay, all right. So you take notes. Please. Okay. So I think yes. So for now I can comfortably go and bring the whole country. Yes.
Yeah. So
there are other diseases too. So keep your eyes on them. You know, in the rainy season, let's look out for cholera. Let's look out for the mpox. Let's look out for the flu. So whatever you pick, please let me know. And then it is better to kill an ant with a bulldozer than to allow it to sneak out and go and harm others. So whatever it takes, let's all concentrate our efforts with dealing with the matter. So thank you so much.
All right, thank you, sir.
Yes. What do you want us to do the donation? Yeah, in the car.
Oh, I think you can do it here.
Okay.
You don't have time. But this is the student clinic.
The hand sanitizers, gloves, hand sanitizers, nose mask. So your tent and your very dramatic. So I think now we can leave now.
All right.
Thank you very much.
Thank you very much. We are very good. You're welcome.
Thank you very much. Yes. Okay. So we just came to assess the situation, the COVID situation on campus, and to see how best we can contribute in containing the virus so that it will not be out of control. So there's no need to panic. The information we have is that it's drastically reduced, and we've not recorded any admissions. We've also not recorded any deaths so far. So I'm told the variant at hand now is not that very harmful, although it's very, very fast. So just relax, don't panic, whatever it is. We're on top of the issues and we'll deal with them. Okay, so thank you very much for the opportunity. And we came to assess the situation because of the spikes in COVID. We've had engagement with the university management. We decided to come to the health facility to assess the situation ourselves. We are told that the cases are drastically reducing, and at the moment we don't have any severe case at hand. We've not recorded any death, so I can assure you that the country is on top of the issues. We even have a treatment for COVID. So these days, COVID is not as dangerous as we used to know it because we have, treatment. And we are also collaborating with the facilities to give them whatever resources they need to be able to contain the situation. So be rest assured, no need for panic at all. Thank you very much for the opportunity.
Honorable, Mama, many for sanitizer in your song. Find your song. Madam, do it again, please. Please do it again. Go closer. Sarah, check out. That's it. Thank you very much.
Thank you very much. Thank you very much for your reception.
Thank you.
So everybody get away.
Then they can't check. Then they can't check. All right, sure. I'll send you a link right now. I was doing live, so I'll send you a link right now, and then we'll see how it goes. Watch your mommy a year, fencing. Mommy. Papa no name Kasa Minister Kasa sending your money designation. Because my sending we know. Thank you.